Welcome. You're likely here because you want the important info fast without wading through dense papers.
Yeah, time is valuable.
Exactly. So today we're jumping into atrophic gastritis in animals. It's basically a chronic stomach issue.
It's a good way to put it. Affects the stomach lining long term.
And we're grounding our discussion in the article, Atrophic Gastritis in Animals, Diagnosis and Treatment.
Solid source.
Our mission really is to get a handle on this condition. What is it? Who gets it? How do we spot it? And what can be done?
Sounds like a plan.
Great. So let's start right there. What exactly are we talking about with atrophic gastritis?
Okay, so fundamentally it's an inflammation problem in the stomach, but it's chronic, meaning long term.
Right, not just a quick upset stomach.
Exactly. And the key feature is that the stomach glands, the little things that make acid and enzymes, they get smaller,
Smaller. How so?
reduced in size and depth. It happens over time. It's not sudden.
Ah, okay, a gradual thing.
Yeah. And this reduction, it can be just in patches, we call that focal, or it might be more spread out, which we'd call diffuse.
Got it. So this gradual wearing down, which animals are most likely to experience this?
Well, interestingly, it's not something you see much in young animals.
Oh, so more in older pets.
Generally, yes. But the overall occurrence, it really varies. Depends on the species, even the breed sometimes.
Breeds. Is there a specific one that stands out?
There absolutely is. The Norwegian Lundehund, it's actually remarkably common in that breed.
Really? The Lundehund?
Yeah, research shows a pretty high percentage, often hitting them between, say, 4 and 13 years old.
Wow.
And within that breed, maybe slightly more males than females seem affected.
That's incredibly specific. What does that tell us?
Well, for vets, it's a big clue during diagnosis, but it also strongly suggests there's a genetic link there.
Ah, genetics. Makes sense.
And for you listening, it really highlights how breed can play a huge role in disease risk. Knowing your pet's background matters.
Definitely something to keep in mind. So, okay, if an animal does get this, what signs should an owner be looking out for? What are the red flags?
The signs can be a bit general sometimes, but they tend to stick around. Chronic vomiting is a big one.
Vomiting, like food or...
Could be food, could be bile.
Ah.
And it's often intermittent, comes and goes. You might also see they're not eating well, anorexia.
Loss of appetite, okay?
Which naturally can lead to them being tired, lethargic, and losing weight over time.
Right, that follows. Anything else?
Less often, but still important, you might see swelling, which is edema, or even fluid building up in the abdomen that's ascites.
Okay, those sound pretty serious. Now, what's actually causing this atrophic process in the stomach?
That's the tricky part. The exact cause isn't always crystal clear. There's something called idiopathic inflammatory gastroenteritis.
Idiopathic, meaning unknown cause.
Exactly. That's considered a possible risk factor.
Mhm.
But it's also important to know that atrophic gastritis can just be the end result of any kind of long-standing stomach inflammation.
So it could follow other stomach problems.
Precisely. And like we mentioned with the Lundehunds, there's that strong suspicion of a genetic predisposition making them more vulnerable.
So multiple potential pathways leading to the same problem.
Pretty much, it could be the main issue itself or the consequence of something else chronic.
Understood. So if a vet suspects this based on the signs, how do they actually confirm it? What's the diagnostic journey like?
It's a step-by-step process. First, you need to rule out other things that look similar.
Like what?
Other types of chronic gastritis, for instance, or chronic enteritis, which involves the intestines. So that's your differential diagnosis list.
Makes sense. Start broad.
Then you typically move to blood work and a urinalysis, CBC biochemistry panel.
And what might those show?
You might find anemia, low red blood cells. Platelets could be low or sometimes high if there's ulceration causing bleeding.
Okay. Platelets can go either way.
Yeah, depending on the situation. Another clue could be low total protein in the blood, but without seeing protein lost in the urine.
Interesting. So the blood tests give hints. What about other lab work?
Well, in some dogs, a condition called achlorhydria has been reported.
The chlorhydria.
Lack of sufficient stomach acid. And that might mess up the bacterial balance in the gut.
Ah, okay.
For cats, it's also important to check for underlying liver, gallbladder, or pancreas issues, and definitely check their vitamin B12 levels. These can sometimes tie in.
So more potential complicating factors in cats.
Can be. And critically, you often need endoscopic biopsies of the small intestine too, just to make sure you're not missing other diseases that infiltrate the gut wall.
Right, rule those out. What about imaging? X-rays? Ultrasound.
Standard x-rays, usually not that helpful for this specific condition.
Oh.
Although sometimes they might show food stuck in the stomach even after fasting, which suggests delayed emptying.
A subtle clue, maybe?
Maybe. Ultrasound, though, can be more revealing.
How so?
It might show the stomach wall is thickened, or sometimes thinned, actually, or it might look normal. Ultrasound also lets us look for masses, check the lymph nodes nearby, look at the intestines, see if there's fluid in the abdomen.
So it gives a better view of the structures?
Yes, and if you see enlarged lymph nodes or a mass, that definitely raises concern about neoplasia or cancer. But even with ultrasound,
It's not the final answer.
no. Imaging provides valuable clues, but the definitive diagnosis really comes down to getting a tissue sample.
Right. You need to see the tissue itself.
Exactly. That means gastroscopy, putting a small camera down into the stomach.
Endoscopy of the stomach.
Correct.
Yeah.
That allows the vet to see the lining directly and, crucially, take biopsies. Tiny tissue samples.
And those samples go off to the lab.
Yep, to a pathologist for microscopic examination. That's the histopathology, and that's where we get the definitive answer.
So what are the pathologists actually looking for under the microscope? What confirms it's atrophic gastritis?
The key things are glandular atrophy, that shrinking of the glands we talked about, plus inflammatory cells.
The signs of inflammation.
Right. You might see neutrophils or mononuclear cells, different types of white blood cells. Usually these changes are worst in the upper part of the stomach, the fundic region.
Okay. And does it look the same in all dogs?
Not always. In dogs that aren't Lundehunds, the atrophy is often seen alongside a specific inflammation pattern called lymphocytic plasmacytic gastritis. Lots of specific immune cells.
LP gastritis, yeah.
You might also see fibrosis, which is basically scar tissue forming.
And what about the Lundehunds? You said they were special. Does it look different in them?
It really can. They have some unique features. Pathologists use special stains, mucin stains, and they can find abnormal mucous neck cells and something called pseudopyloric metaplasia.
Pseudopyloric what now?
Metaplasia. It means one type of tissue is replaced by another type, which should normally be. It's quite specific.
Fascinating.
Yeah.
Very detailed.
And there's also the potential for neoplastic transformation to cancer development. So pathologists might see an increase in neuroendocrine cells, which also requires special stains to identify properly. It's like a distinct microscopic signature for the breed.
Wow, that's remarkable. Now, the article mentioned Helicobacter bacteria. What's the story there? Is it a cause?
Helicobacter. Its role is, well, it's a bit complicated, especially in dogs.
How so?
While Helicobacter has been found in cats that have atrophic gastritis, proving it's the cause in dogs hasn't been consistent.
So finding it doesn't mean it's the culprit.
Not necessarily.
Yeah.
Just finding the bacteria, maybe with a urese test on a biopsy, doesn't automatically mean it's an active infection causing the gastritis. That test isn't always reliable for diagnosis in this context.
So what does suggest it's a problem?
What you really need is for the pathologist to actually see the spiral-shaped bacteria on the biopsy and see inflammation associated directly with them. That suggests a clinically relevant infection.
Okay, so it's about the bacteria plus the inflammation it's causing.
Exactly. Not just its presence.
Right. That makes sense. So we've covered what it is, who gets it, the signs, the diagnosis. Let's talk treatment. How do you manage this?
Yeah, treatment. Unfortunately, there isn't one single best treatment that works for every case. It's often about managing the signs and tackling any underlying issues found.
So tailored to the individual animal.
Very much so. If you suspect a food sensitivity might be involved, you might try a dietary trial.
Like an elimination diet.
Exactly, using a novel protein, something the animal hasn't eaten before.
Yeah.
If there's a thought that bacteria responsive to antibiotics might be playing a role, sometimes the antibiotic tylosin is used.
Okay.
And if an animal is really underweight, severely malnourished, sometimes a feeding tube is necessary just to get enough calories in.
That sounds intensive.
It can be, but vital in some cases. Diet-wise, if slow stomach emptying seems to be an issue, switching to diets low in residue and low in fat can help. Those novel protein diets can be useful here too.
So diet plays a big role in management. What about medications?
Oh yes, medications are usually a cornerstone. Acid reducers are very common.
Like antacids.
Sort of, but more powerful. H2 blockers, like famotidine, or proton pump inhibitors, PPIs, like omeprazole. They reduce stomach acid production, which can help soothe the lining and prevent issues like esophagitis.
Okay, omeprazole is pretty common.
It is, but a word of caution. Long-term, continuous use of omeprazole isn't ideal if you can avoid it.
Ooh. Why is that?
Potential side effects. Things like reduced calcium absorption leading to weaker bones, possibly disrupting the gut microbiome, low vitamin B12, maybe increased risk of diarrhea. So we use it strategically.
Good to know. What if vomiting is the main problem?
Anti-vomiting meds, antiemetics are key. Meropitant is one, ondansetron is another. And if the stomach isn't emptying well, drugs to help motility like metoclopramide or cisapride might be used.
So, a few options depending on the specific symptoms. The article also mentions something called triple therapy.
Ah, yes, triple therapy. That's usually reserved for cases where you have that confirmed Helicobacter infection we talked about, seeing the bacteria with inflammation on biopsy.
And what's in that therapy?
Typically, it's a combination. 2 antibiotics, usually amoxicillin and metronidazole, plus an acid blocker like omeprazole or famotidine for a set period.
A specific protocol for Helicobacter.
Correct, though it's worth remembering that even after treatment, the infection can sometimes come back.
Right. Are there any medications vets should definitely avoid in these animals?
Absolutely. Big ones are corticosteroids and NSAIDs, nonsteroidal anti-inflammatory drugs.
Why avoid those?
They can both be really irritating to the stomach lining and can significantly worsen gastritis, so extreme caution is needed or avoidance altogether if possible.
Okay, important precaution. So, managing this sounds like it could be an ongoing thing. What's the long-term outlook usually like?
It often is a long-term management situation. Some animals might need antacid therapy intermittently, on and off, for quite a while to control symptoms.
But not the long-term daily omeprazole, if possible.
Ideally not, if other strategies work, due to those potential side effects we discussed. The other major long-term consideration is, well, it's the potential cancer link.
Ah, yes, you mentioned that.
There's a suspected association, though it's most clearly established in the Norwegian Lundehund, between atrophic gastritis and developing stomach cancer later on, adenocarcinoma or neuroendocrine carcinoma.
That's a serious concern.
It absolutely is. And it means ongoing monitoring is really crucial for these patients. This is vital information for you, the owner, to understand.
So what does that monitoring involve?
If the clinical signs aren't resolving, or if they come back after improving, then monitoring for tumors is recommended. That might involve chest x-rays to check for spread, and definitely repeat abdominal ultrasounds to look closely at the stomach.
Right.
Regular vet checkups are key.
Diligent follow-up is essential then. Okay, let's try to wrap this up. We've learned that atrophic gastritis is this chronic inflammation causing stomach glands to shrink, notably affecting Norwegian Lundehunds.
Right, that breed connection is striking.
Diagnosis really hinges on getting that stomach biopsy and looking under the microscope.
The gold standard. Yeah.
And treatment. It's about managing symptoms, diet, acid reducers, other meds, dealing with underlying causes, being careful with long-term drugs like omeprazole.
And being aware of medications to avoid, like NSAIDs.
And critically, especially in breeds like the Lundehund, keeping a close eye out for potential stomach cancer development down the line through regular monitoring.
That really covers the key takeaways. It's a complex condition.
It certainly is, and it leaves us with something to think about, doesn't it?
Always.
Given that we see potential genetic links, like with the Lundehunds, and the connection to chronic inflammation, it makes you wonder what kind of research could really push our understanding forward.
That's a great question. What could help us figure out the deeper mechanisms? And maybe, just maybe, find ways to prevent this in the animals most at risk.
Food for thought indeed. What could unlock those preventative strategies? It's definitely an area needing more exploration.